Hello, everybody. Helena Webb here. For those of you who don't know me, I'm running for state representative in District 100, which includes parts of Chesterfield, Baldwin, Winchester, and one precinct in Town and Country. And we're self-isolating because of COVID, and I am doing lunch with Helena occasionally because I want to make sure that I can keep connecting with everyone out there and keep learning about what's going on, keep in contact with people who are on the ground working with COVID-19 patients and essential workers, and to make sure that we keep our leadership accountable to us. So that's the purpose of these broadcasts, and thanks for joining us. Today I have with me a local pediatrician who I'm going to allow to introduce himself. Thank you for being here, Greg. Hi, Greg.
Thanks for inviting me. Yeah, I'm Gregory Finn from Bluefish Pediatrics in St. Louis, Missouri, and De Pere, Missouri. Lovely De Pere. And it's certainly a different world in the last month or two. How are you, Helena?
I'm well, actually. So on a personal note, my mother-in-law was in the hospital, in and out of the hospital, since March 10th, and she got out of rehab on Friday. Some people know this. She had to go back yesterday. She had to go into the ER because she had a fever and she has pneumonia. And it's a strange time, you know. But yes, that's how we're doing on a personal level, on a sort of statewide level. I'm glad that the governor put out a stay-at-home order. Unfortunately, it didn't have a lot of teeth in it. There's a lot of exceptions and almost no enforcement. So I am disappointed in that. But back to the situation here in the St. Louis region. What are you seeing in your practice, and how is this affecting you and your patients and your practice as a whole?
Sure. You know, our first consideration in the practice is always for the patients, and then our second consideration is for our staff. And for the patients, just from a medical or infectious disease standpoint, strangely, this seems to affect the pediatric population less than the adult population. And that's strange for an infectious disease. Famously, things like influenza affect young children much more severely than they do, say, a 40 or 50-year-old quite often, where this seems to have the opposite. And I wouldn't be cavalier, I wouldn't be careless. Certainly, infants and young children can be hospitalized with this, and there are recorded episodes of deaths that seem to be associated with COVID-19, although we're not sure that the deaths are due to the COVID-19. But it does seem like the children and young babies are much less affected. But certainly the parents, and especially the mothers, are no less worried. Mm-hmm. And it has certainly changed how we practice medicine. It's certainly changed how we format our practice, and it's certainly changed how our staff operates.
Can you tell us about some of those changes?
Well, we, for the last month, have met as the four of us partners nearly every day to decide what the rules are for the day. And we're basing those on the recommendations of infectious disease experts at St. Louis Children's Hospital, based on recommendations from the CDC, and listening to pronouncements from experts such as Dr. Fauci. And we quickly decided that we had to get rid of any non-essential visit, non-urgent visit. So we had to make a decision of what types of well visits or well checks were more urgent. For young children, infectious diseases such as Haemophilus influenza, which can cause meningitis and are very dangerous, or streptococcus, which can cause blood infections and pneumonias, are high risks to them. And they're higher risks than are things like COVID-19. So we didn't want to ignore the need for those vaccines for the very young children. Those are a higher risk. Those diseases are a higher risk than are this virus. Mm-hmm. And so we decided to continue vaccinating the young children for those important infectious diseases. Mm-hmm. But for children under 2 years old, we're continuing those vaccines. For those over 2 years old, we're not doing any well visits at this time. We're delaying the well visits until we feel like it's a safer time.
Mm-hmm. And for you, what would be a safer time? I mean, I think we hear a lot about how long this is going to last, whether we're going to have global testing, if we're going to have a vaccine, and what would be a comfort level? When do you feel like we're going to be able to do those wellness visits for kids again?
We really have no idea how long this is going to last. Predicting this is like predicting the weather or predicting the stock market. People make guesses, and then somebody, if they happen to randomly get it right, somebody says, well, wow, what a genius, where I think they lucked into a guess. So we don't know how long this will last. It's possible it will calm down in the next month or two, but we really don't know. Mm-hmm. We're hoping that by June, things will calm down enough that we can resume some of our routine well checks, but we don't know that that's true. Mm-hmm. And we don't know what the rhythm of this will be, and we don't know if it does calm down, if it will become a seasonal disease, much like influenza is, where it might resume in the fall or the winter and hit us again before we have a vaccine. Mm-hmm. One thing that we've talked about with our colleagues is not a lot. I mean, a lot of our parents are well educated, and they, of course, like us, they want the best for their children. But sometimes they have a little resistance to some vaccines or worries about it. And we do remind them now that, we want the best for their children too by getting the vaccines they need. But this is like what the world is like when we're missing a vaccine to just one disease. Mm-hmm. You're missing a vaccine to just one disease, and this is what happens. So mm-hmm. It's unfortunate, but it's true. And I'm hoping that a good vaccine comes along as fast as possible. But as fast as possible would be 12 months. That would be an incredibly fast developmental speed for a vaccine. And honestly, if we can have it in 12 months, I would be quite amazed.
Mm-hmm. Yeah, I agree with my experience is that these, in my work with the healthcare industry, is that these things take a long time and a long time to get approved, a long time to test, a long time to get approved, let alone the R&D. So what have you done? Have you had to lay people off? Are you going in shifts? How are you handling changes within the office?
Sure. So I mentioned that our first duty is to our patients, and then our second duty is to our staff. And so we have reduced down to a very small number of well visits, and almost all of our sick visits have disappeared, and we're handling them over the telephone or in a different fashion. So certainly our need for staff in the office has diminished, but we made a promise to our staff very early on that we're not going to leave any of them out. We're not going to let any of them go. We're going to keep them whole in terms of their salary and their benefits. Mm-hmm. And so we're continuing to employ them. We're continuing to use them as much as we can in the office, but we're continuing to keep them full in terms of their pay and their benefits. That was a commitment we made early on.
That is a concern, I think, for a lot of the folks who get laid off, is what happens to their benefits. And obviously people can go on COBRA if they had if they have a policy, but there's a lot of uncertainty there, an increase in cost for some people. It's a big time of uncertainty economically, and taking those kinds of payments on when one loses one's job is difficult, but essential in this time. So I think we're going down a road we haven't had to go down in a really long time, and who knows where it will land. I was wondering, have you heard from talking with your colleagues, are there any populations that you feel are more affected? I know, a lot of our essential workers, our doctors and nurses are on the front lines, but I know that now the government is talking a little bit about tracking the infectious rate and the disease rate potentially by race as well, because there are some underserved communities. Have you heard anything about that's kind of a surprise question? We didn't talk about this ahead of time, but just wondering if you've heard anything about that, or if you have any insight into how this might be affecting different parts of the St. Louis area differently.
So I haven't seen data on the St. Louis area specifically, but I have seen data from New York City and Louisiana, sort of suggesting that some of the minority population, and especially African Americans, seem to be particularly hard hit, especially in terms of deaths. And for reasons unclear, generally on average in the past, African Americans often seem to have less access to health care, and seem to sometimes have a heavier burden of hypertension or diabetes. And we know that that could put you at higher risk for serious cases of pneumonia or complications with COVID-19, but it's not clear if that could be the reason. But it does seem from preliminary data that they may be suffering a disproportionate number of deaths. Certainly in the early data from China and Italy, it appeared that males suffered many more deaths, a disproportionate number of deaths, possibly from risk reasons. Certainly in China and Italy, many more males smoke, and males maybe had a higher number of high-risk health conditions. But we don't know if that's the reason. But certainly that gender difference seemed to play out both in Italy and China. Mm-hmm. And I don't know if that has played out as much in the United States.
Okay, thank you. How do you feel we're doing in the county and in the city? Are there things that you feel we're doing right? Or you think there are things that we should be doing differently as a healthcare provider from your perspective? What would you like to be seeing from our leadership?
In the county and the city, I think that the leadership has done a fairly admirable job. But it's difficult to be an island in an ocean that seems to have done maybe only a minimal amount up until recently. And I understand, I'm not a political animal, and so I wouldn't play well in that playground. But I understand that there's maybe a libertarian argument of, hey, the government should leave me alone and let me determine my fate. But when it comes to a pandemic, your actions directly affect the actions of everybody else. And though somebody who is of that mindset might say, please leave me alone, and if I choose to expose myself, that's my business. But to some degree, when other people are going about their business in a pandemic and exposing others, it's somewhat like drunk driving. Somebody could argue, like, if I want to drunk drive and put myself at risk, it's my choice. But most reasonable people would say, well, hold on, you're putting others at risk. You could crash into them and kill other people. And so drunk driving isn't all about you. And even if you didn't crash into other people, the first responders who have to come and clean up the wreck, you're putting them at risk. And the healthcare providers who have to take care of you and the hospital resources, you're using up a lot of resources. So it's not all about you and your rights and freedoms. You do have to consider others, because we are a population that works together, and we're going to try to save your life, even if you might have made a poor choice. And so states and governments altogether have to make unitary choices to fight this together. And until we do that, it's going to be very difficult to tamp down the rate of contagion with this disease. And I'm not somebody who can make a decision at a state level. I don't know what the considerations are. But I would hope that all the states would make this decision to tamp this down in terms of shelter-in-place orders or keeping people in their homes as much as possible.
Yeah, I'm glad you brought up the idea of sort of shared responsibility, because something that a lot of people don't really realize is that no matter what we do and how much individual freedom we have, we share the responsibility of the cost of these kinds of situations. Anything that's statewide, anything that is national, we share those costs collectively, and we don't like to think about it, and it's not a good political talking point for a lot of folks. It gets kind of in the weeds, and it's a little bit of a deep dive, and people don't really want to think about it. But the fact of the matter is that every time you build a road or you hospitalize a person who doesn't have insurance, we're all paying for those things to some degree. Our taxes do pay for those things, and the cost, especially in healthcare, is shifted. People have to cover their costs. There are nonprofit hospitals and such, but most of the structure of our healthcare system is built for profit. And I have nothing against people making money, but we have to acknowledge the fact that if people have to be provided care for free, or that they can never pay back because they don't have an income over $20,000 a year and their visit cost $20,000. That cost does get shifted. It gets shifted to the taxpayers who help pay for those costs. It gets shifted into our insurance premiums. If one place gets cut, if one line item gets a budget cut, you're going to see costs go up on other line items because everything has to get paid for eventually. And saying that if I worked hard and I have insurance and I don't want to pay for somebody else's insurance, it makes total sense in a top line kind of way of thinking, but it doesn't make sense at the bottom line is that your insurance premium goes up or your boss's insurance premium covering you goes up and your deductible goes up. All of that happens, and I really feel that if we took a proactive, outcome-based view of healthcare in our state, that we could get people healthier. It costs a lot less to care for healthy people than sick people, and we'd have a more productive workforce. I just hope we realize, the federal government is coming in to save us. They're coming in to provide us with money to pay for COVID-19 healthcare, and with stimulus packages for workers and for businesses, and all of that is going to come back, and we are going to have to pay for it. It is not free. Nothing in life is free. So let's see. I guess I just wanted to ask you, do you have anything else you'd like to share about our time's just about up? We try to keep these to about 20 minutes, so it's literally the time it takes to eat a sandwich. Wondering if you have any other thoughts.
Sure. I can tell you in my practice, I can see when I do have the few visits in person with the parents, I'm mostly seeing moms, sometimes the dads, and I can see the wear and tear, the sort of emotional wear and tear in their eyes. And one sort of statistic, I'm a person who loves numbers and loves statistics. I remind them that just from a baby point of view, from a child point of view, it's the safest time in world history to be a baby. Mm. And so I know they're worried about their children, but compared to 50 years ago, compared to 100 years ago, this is the safest time ever to be a baby. And so I know it feels very unsafe, it feels very unstable, it feels very out of kilter, but their children are pretty safe. And so it doesn't mean cavalier, it doesn't mean to not be careful, but the children are pretty safe. So, still get the health care for them, still get their vaccines, still take care of them. But your children are in pretty good shape. And honestly, I think the kids are going to come through it fine. I'm worried about the parents, but the kids are doing pretty well.
I love that. Thank you so much for that. That's a really nice way to end our conversation. I always try to look at the positive side of things and the opportunities that we have. And I really appreciate you sharing that with us. Thanks for being here, Greg. Really appreciate it.
Thanks for the invitation. It's a pleasure.
All right. Well, that's it for today. Thank you all for joining. If you missed the beginning, you can always watch again later. And tomorrow we're going to have Jennifer Rushing joining us. She works in the hospitals, and we're going to ask her what she's been seeing in the hospitals relating to her care of patients that are coming in. And thank you. Stay safe, stay healthy, and stay positive. It's going to be a long haul, and we all want to make sure that we're there for ourselves, for each other, for our families, and we'll get through this together. Thanks so much. Have a great day.